Good afternoon, all. I am Mrs. Deepikashree from the Department of Physician Assistant in the College of SNS, Allied Health Sciences. Now we are going to discuss about the topic is aneurysm. The case scenario is 41-year-old male MRI for evaluated the suspected brain tumor due to compliance of loss of balance associated with diplopia. He was found to have an aneurysm in a left internal carotid artery. He underwent a catheter cerebral angiogram to assess 3D structure of the aneurysm and plan for further management. How will you manage the patient? So now the aneurysm, it is one of the bulging weakened area in the wall of the blood vessels, resulting in an abnormal widening or ballooning greater than 50% of vessels normal diameter. An aneurysm may occur in any blood vessels, but it is most often seen in an artery rather than a vein. Classifications of aneurysm. There are three types of aneurysm: true aneurysm, false aneurysm, and pseudo aneurysm. The true aneurysm involves three layers of an artery, that is intima, media, and adventitia. True aneurysm is also known as atherosclerotic and congenital aneurysms. The false aneurysms, or pseudo aneurysm, it is the collection of blood leaking completely out of an artery or vein. The pseudo aneurysm can be caused by trauma that punctures the artery, such as knife and bullet wounds, as the result of percutaneous surgical procedures, such as coronary artery or arterial grafting or usage of artery for infections. So this is the type of arteries. The first one is fusiform artery, second is pseudo aneurysm, third one is scalar and dissenting and ruptured aneurysm. The fusiform and scalar aneurysm, sacral aneurysm. The fusiform aneurysm is the bulge or balloons out on all sides of the blood vessels, overall the most common type. The sacral aneurysms bulges out only one side and are the most common type of cerebral aneurysms. And causes. The causes of aneurysm is the congenital aneurysm, atherosclerosis, hypertension, inheritary diseases that may result in weaker than normal blood vessel walls, trauma such as crush, injury to the chest, the sexually transmitted infection, syphilis, if untreated, targeting the aorta and weakening its wall. Polycystic kidney disease, very occasionally an infection targeting and weakening the section of blood vessels. The causes sometimes remains unknown. And the type of aneurysm based on the location of the aneurysm present in a body. So cerebral aneurysm, thoracic aortic aneurysm, abdominal aneurysm. And risk factors are smoking, tobacco, hypertension or high blood pressure, poor diet, inactive lifestyle, obesity and cocaine use. The complications of aneurysm are blood clots with an aneurysm, compression of nearby nerves if aneurysm is large enough, blood leaking out of the intact aneurysm in the wall of the artery, impaired blood circulation beyond the point of the aneurysm, hemorrhage in the layer of tissue surrounding the brain, subarachnoid hemorrhage, water on a brain, hydrocephalus, stroke, epilepsy, paralysis, congenital heart failure, heart attack, kidney failure and sudden death. And pathophysiology of aneurysm. Due to etiological rasmus like atherosclerosis, trauma or infections, the rupturing of the trauma or infection which leads to weakening and degeneration of the blood vessel wall, which leads to hypertension injury, which leads to aneurysm expands, which leads to further weakening of walls, which leads to rupture if not treated, which leads to rupture. And the diagnosis of aneurysm: history collection, physical examination, X-ray, CT, MRI, digital subtraction angiograms, examination of cerebrospinal fluid. And the medical management, the medicines are used to lower blood pressures, relax blood vessels and lower the risk of rupture of aneurysm. Beta blockers and calcium channel blockers are the medications most commonly used. And anti-seizure drugs, cerebral aneurysm, examples like levetiracetam, that is Keppra and phenytoin, and nimodipine to reduce the risk of the blood supply to the brain becoming severe. The surgical management or cerebral aneurysm for coiling, ligation, And banding. These are the common surgical procedures we use to for aneurysm patients. Thank you.